All right, everyone. We ran out of time, and I had said that I would record the review of the last article, which is an RCT. That is the one by Roberts, Clegg, Wang, Chapa, Orellano, Tehran, Reyes, Delgado, Ram, and Shirk. Or how about just Roberts et al.? Constraint therapy with and without virtual reality for children with unilateral cerebral palsy, a randomized control trial. Okay, so um, on the right of my screen here, you can see I've already filled out the inclusion, exclusion criteria, and a little bit about the group descriptions. But let's go and look to see where I found all of that. So, obviously, this is the article here. And generally speaking, when I'm looking for information about sampling, I'll go to the methodology section, or quite simply, there's usually a section that says sample or participants, which you can see here at 2.2. Okay, so here's where I have gotten all of this information. So, firstly, we want to look for the inclusion criteria, and it actually blatantly states the inclusion criteria for participants in this study included a diagnosis of UCP. Okay, so that's the first bullet. Participants were then classified, right, as level 1 or 2, so I added that. They had to be between 5 and 14 years of age. They had to be able to follow directions and complete the entire assessment protocol and all the group activities. Okay, I didn't put anything about ethnic or racial groups or English speaking because, you know, they didn't have to be included. That's just a statement. Now, any participant with uncontrolled epilepsy, right, or significant visual impairment were excluded. So that would be our exclusion criteria, which you can see I put over here. So uncontrolled epilepsy or visual impairment, and also any patient with severe behavioral problems, or asymmetrical presentation of upper limb function. All right, so those were patients that could not participate in the study. So that is how I completed part 4, inclusion and exclusion criteria for that third article, which is an RCT. Then I went on and I wanted to describe the participants in the group. Now, in this one, I decided it was particularly important to comment on the power analysis that was done, and that is because they did they calculated an effect size. Essentially, they did a statistical analysis to see how many participants they would need in order to show that this was effective. So sometimes it's called calculating an effect size. Sometimes you do a priori power analysis. That means you do it beforehand. Well, they did, and they determined that they needed 24. So that's how they come up with the sample size that they used for this study. And so it was 24 participants, and then they randomly assigned them and blindly assigned them to one of two groups. One group got the constraint therapy standard protocol. The other one got that plus virtual reality. Both groups had a total of 60 hours of intervention. All of this is in here under the protocol. Okay, so I'm just scrolling down in the article. It was 6 hours a day, Monday to Friday for 10 days. That was equal for both of them. What differed between the two groups, and this is what's important to note, is the standard protocol got 50 hours of constraint-induced movement therapy and 10 hours of just bimanual skills. That was considered the standard protocol, or care as usual. And group 2 got 44 hours and then 16 hours of VR. What I'm interested in when I'm going to comment on this is why didn't they do 50 hours of CIMT for both and just 10 hours of VR? So that would be a question I would have in terms of why did they do 6 hours less in group 2? And then they told us what the VR based tasks are. So that in a nutshell would be part 4 and 5 of the paper. All right, I hope this is helpful. Make sure that in the discussion board, you just say that you viewed it and you're all set. And if you have any questions about your articles, please feel free to reach out. Thanks. All right, have a great weekend.